Welcome back to No Slouch No Ouch. My name's Mason,
My name's Alex.
and today we're going to be talking about red flags or warning signs of working with your low back.
All right. Well, we just wanted to touch on a few things that we want to keep an eye on while we're going through an exercise program, or things to watch out and maybe go see our medical professionals about if these things persist. So with further ado.
So the first one we're going to talk about is if your symptoms aren't changing with exercise. So if you're trying something out and your pain isn't getting better, or if it's not getting better over time, you try a few different things, please go and see somebody just to get it checked out.
Mm-hmm. The next thing we're going to talk about is saline anesthesia, and this is a numbing of kind of the butt or the groin area that sticks around. So it's not just something that, if you're sitting and your butt's go numb, and you stand up and it goes away. We're talking about something that sticks around as you're walking, as you're moving, that's really persistent. That's definitely something that we need to get checked out, and that's going to also come along with possibly some bowel or bladder dysfunction. So if you're noticing anything, incontinence or things along those lines, that's going to be something that we want to get checked out with a doctor as soon as possible.
Right, and going off your point of numbness, tingling, if you have any numbness or tingling in any other extremities, that's going to get worse, or you have muscle weakness there and associated with that, go in and get checked out just in case something's going on.
Mm-hmm. Other things to consider that may or may not be directly related with exercise is unexplained weight loss. So if you aren't putting yourself on a diet regimen or a new workout regimen, or making significant changes, and you notice either weight loss or significant weight gain, this is going to be something that we want to also take a look at.
Right. And then if you have fever, chills, or sweating lasting more than a couple of weeks or more than a week, and you get up to a high-grade fever at 102 Fahrenheit or above, that's something else that we need to check. You need to get checked out for in case there's an infection or something else going on with your body.
Additionally, loss of appetite. So if or significant appetite changes that are persistent, so you find yourself not eating or eating a lot, this can also come and go with a little bit of weight gain, nausea, or vomiting. Those are also some things that we want to take seriously and make sure that we're just getting checked out thoroughly with our medical professionals.
And then if you're getting dizzy or lightheaded or any blurred vision when you're doing exercise, or even when you're just sitting at your desk or doing normal things throughout your day, that's another thing you want to be aware of.
Mm-hmm. If you notice being fatigued or extremely tired that's been persistent for several weeks, 2 to 4, that's going to be a sign that something may or may not be going poorly. And that could be anything from diet to other significant health issues that we won't cover here, but it's, again, one of those things that you want to make sure that you're just checking off and making sure that you're fit and well to do exercise.
Yeah. And if you're having night pain where pain comes on at night and you can't find a position of comfort and go back to sleep, that's another indication that you need to go in and see a provider.
Mm-hmm. Another one that we'd like to talk about too is malaise.
Ooh, big word.
It is. It is a fancy word for just saying that you don't feel well. And you can't quite necessarily put your finger on it. You just feel out of it. Maybe persistent fog, like kind of a brain fog, or maybe low level nausea, whatever it might be.
Feeling run down.
Yep, feeling run down. It all kind of wraps up in that fatigue and those types of issues, but it's one of those things that we like to coin. It's given a name just because there isn't a specific thing that you can point to, and it's something that sticks around persistently too.
Yeah, and then going off kind of feeling mentally foggy, or another one is if you're feeling like you're having mental changes, so you're having trouble doing any mental tasks like math or subtraction. I struggle with long division.
Yeah, you do.
But I don't think that's because of cognition, hopefully. Who knows? I should probably go get checked out. But if you're having any changes in cognition, or if you're having trouble like knowing where you are, what time of the day it is, something along those lines, go get checked out as well.
Mm-hmm. So if you're also experiencing prolonged periods of shortness of breath, and we're not just talking about, hey, you decide to take the stairs today and you're a little winded, which happens to me every time in this building. We're talking about something like even with real basic activities such as moving around, getting up from your chair, and it sticks around too. It's not momentarily. That's something that we'll want to make sure that we're taking a look at.
And then if you are being short of breath, something along those lines, sometimes you can get lightheaded, dizzy, and have what we call syncope, or just kind of passing out or fainting, or feeling really, really lightheaded, so you need to sit down. If that happens to you as well, go get looked at just in case something might be going on. Again, we're just trying to rule out everything that might be happening.
Mm-hmm. Another thing we like to look for, or just keep in mind with low back pain, is function of the kidneys. So that's one thing that we'll keep tabs on. What we like to refer to, what generally is associated with the kidney and low back pain, is that it's kind of that top of your back pain, and it's really specific to an area. It's kind of in like the lower rib cage, or even high low back, if that makes sense. So, but it's very persistent, and sometimes will come on with, when you have to go to the bathroom, or when you have a full bladder, or things along those nature. Just keep an eye on that, and if you notice that you're getting that specific pain in that area, definitely go get checked out with your doctor.
Last one we're going to talk about is called ankylosing spondylitis. It's a very scary sounding term. It just means that there's some inflammation going on with your back bones, and that is something to get looked at. Some of the things we see with this is it's typically worse in the morning and worse with rest rather than getting better when you're moving around.
And it typically is associated with something like rheumatoid arthritis,
Yes.
or autoimmune. Is when we typically see it. So if you don't have a history of those things, it's probably unlikely, but just something that we want to keep in mind.
Right.
So this is one of the last components that we'll kind of talk about as part of our education week, and we just want to make sure that you guys know a lot of this stuff sounds scary, and it's not all very common. For most low back exercises, a good percentage of people do not experience these things, but just because you are working independently, we want to make sure that you are aware of when low back pain may be a signal for something that you can't manage on your own, and something that you may need seeking a little bit more professional help with.
And it's always good to err on the side of caution, because if something like this does show up, we'd rather have you go and figure it out rather than just decide to push through it and have something not ideal happen. So
Exactly. And generally, all the exercises that we have prescribed are not going to exacerbate anything or be harmful. However, if they aren't helping, it again is a sign that we just need to be addressing it from a different angle and with some expertise on our side.
Right.